Hi, Todd. I'm going to give you a bias answer just because I work with cognitive behavioral therapy, meaning that I teach people skills to help them think differently and behave differently so that they can come to me for 10 to 12 sessions, learn some skills, and then go out there and practice those skills on their own. To me, therapy doesn't mean forever. So I think it's great that your wife has this team of treatment providers. I would encourage you or encourage her to make sure that they're all communicating together, to make sure that they're all on the same page in terms of what goals they're trying to reach. Make sure that your psychiatrist and your social worker and the therapist, that they're all talking. And then in terms of treatments for anxiety, like the last guests on the show, I'm a big believer in exposure, and I'll tell you a little bit about what that means. Exposure is a means of safely and systematically confronting the thing that you're afraid of. So it's not, if you're afraid of bridges, it's not just driving right across the bridge. It might be first going and looking at the bridge from a distance and getting over that anxiety and then moving a little bit closer. So what I would recommend is that your wife talk to her therapist about doing some type of exposure, learning some specific skills to deal with the anxiety rather than just going in there and talking about whatever's on her mind.
Well, you're also mentioning something, Jeff, that I think is very important. It also means to try to identify some specifics about the anxiety so that you can get a handle on it, so it's not so amorphous and so overwhelming.
Yes, exactly. Because we're like I said, we're all anxious at some point, but a good therapist will help you figure out what you're afraid of, what you're scared of, what makes you nervous. And it might be 10 different things. That's okay. But figuring out which one makes you more nervous and then figuring out how to approach that thing that you're scared of. And it might also mean that your wife needs to learn some emotion regulation skills, some distress tolerance skills, some interpersonal
What do you mean
skills.
by these?
So distress tolerance, and we can talk a little bit more about this when we talk about dialectical behavior therapy, but distress tolerance skills are kind of those safety skills. So I'm in a situation that suddenly that fills me with overwhelming anxiety. What do I do? In your last hour, you talked about people who were hurting themselves, harming themselves. If something like that comes up, instead of me lashing out at others or lashing out at myself, what can I do in that moment to help calm myself down? Is it, like you said earlier, it's such a great way, exercise? Do I do jumping jacks? Do I stand in place and do jumping jacks? Do I go for a walk? Do I pull out a poem that soothes me, or a prayer, or something else that helps me calm down? So those are distress tolerance skills. Emotion regulation skills are, what can I do overall to help myself deal with my overwhelming emotions? So that's why I talk about finding a therapist that's going to teach you skills rather than just, I'm going to come in and talk about whatever's on my mind.
But let's talk practically about what Todd's question is. How can I help with this overwhelming anxiety? I mean, he hasn't defined what it is, and I don't think we need to define it specifically under these circumstances. But he's asking a question, how do I go about helping under these circumstances? And one of the first things that you said I thought was so important. Are these various treating people that she is involved with communicating with each other? Is there some sort of coordinated plan here? And is there, and I would just add as a follow-up to that, would there be a role, and would you agree to this, would there be a role for Todd to maybe mention to the therapist or whoever's in charge of the treatment plan, is there some specific plan for some specific handling of specific anxieties that she's feeling? She's feeling these gross anxieties overwhelming her all the time, like she's in the midst of a storm of anxiety. Can we start to pick out little ones one at a time and deal with it?
Well, he would probably either have to get his wife's permission to talk to the therapist about those things, or go into session with his wife to talk to the therapist, or because of confidentiality laws. So it might be hard to just, or impossible, to call up the therapist and say, can I talk to you about my wife's treatment? He would have to get his wife's permission to do that.
Todd, have you seen a therapist along with your wife with regard to planning for her future and how she's doing?
Not yet.
Not yet means there are plans in place to do so?
Well, yeah, I told her if she wanted me to go with her, I would. but I guess she's just not at that point yet.
Well, one of the other things that I might then recommend, I hate to throw another mental health professional into the mix and really confuse things, but it might be that you and your wife need to do a little bit of couples counseling just to get that communication open and moving. And again, couples counseling doesn't have to be forever. You might figure out
short term.
It might be short-term couples counseling where you and she just figure out a game plan in session
for the stress that the couples themselves are going through right now.
Exactly. Or there might be other things going on that we don't know about.
Could you